blessed people. By the time this video is posted, I'll be 38 weeks pregnant, and I just wanted to share with you a bit of a pregnancy update, some symptoms that I'm having, and then at the end of the video, I'll also share with you my birth plan and who is on my birthing team. If you're new to my channel, welcome. My name is Anissa and I summarize parenting books into short videos weekly. I also provide videos on our own lifestyle. Let's get to it. So I'm 9 months pregnant with our second baby and we don't know the gender of the baby. I think one of my midwives know, and then the rest of the team don't know, which will be super exciting for everyone. What we do know is that the baby is head down and its face is facing towards you. Essentially, the back of the head is at the back of my back, which isn't ideal and can cause some sacral or pressure on your spine. Besides that, it is rotating left and right and moves a lot. So now the problem is varicose veins. Varicose veins started to appear around my second trimester and has worsened in my third trimester. Now they get really enlarged, warm, and just painful towards the end of the day or if I'm standing and walking too much. Varicose veins are enlarged veins and they can become uncomfortable. What happens is during pregnancy, there's an increased amount of fluid in your body and therefore there's an increased chance of getting varicose veins. I didn't have it with my first pregnancy, so this is something new for me in my second pregnancy, and I don't think it's very common. Because of this, I've been trying to wear compression socks or just taking breaks throughout the day, resting, lifting up my legs above my head, and sleeping with elevated legs. Just recently, I started getting sciatica pain, and that's just been increasing throughout the day, and now I'll get shoots of pain like all day long. Sciatica pain is pain that radiates from the sciatica nerve. The sciatica nerve starts at the lower back and then it branches at the hip and it goes down each leg. So what happens is during pregnancy, the baby that's growing inside puts a lot of pressure on the sciatica nerve, and this can cause shooting pains down one or both legs. It feels like somebody is pinching or jabbing your leg and then you have to like pause for a second. You can't walk. You can just let the pain pass, which only lasts like a second or two, and then you can walk again and go about your day, but then it'll happen again. So this is when I started seeing a chiropractor to help relieve some of this pain. And I'm seeing a chiropractor 2 to 3 times a week. I don't know if it's quite helping or not. Seems to be helping. However, now both legs are getting the sciatica pain and it's throughout the whole day from morning all the way till the evening. It is definitely a lot more frequent if I have been walking a lot or standing for a prolonged period of time. Just like the varicose veins, I'm trying to wear compression socks, limit walking, rest when I can, and limit standing. Now let's get on to my birth plan. I'm going to share with you my birth plan, then we'll talk about my birthing team if you want to stick around for that one as well. So here's my birthing plan, or I called it Anissa's birthing guide, and it should only be 1 page. It should be short and concise. This is essentially a wish list for labor and delivery. The one I'm using is fairly similar to the one I had with my first pregnancy with very minor changes. I had a natural birth at a hospital, and this time around I plan to have another natural birth at a birthing center. At the start of your third trimester, you'll want to share your birth plan or your birth wishes with your healthcare provider, either your OBGYN or a midwife. I'm going to post mine here as I talk about it, and I'll also leave a link in the description box below if you want a closer look at my birthing plan. I'm simply sharing this with you so you get an idea of what a birthing plan looks like. I broke up mine into 3 main phases, and I'll post it right here and I'll talk through it. So the first thing, I just want to put out some key points here, and that is that I'm a hypnobirthing mama and I want to achieve a natural birth. I'm directing all questions to the father, and then I have a doula, and her name is Hillary, that will be also working with me. If you practice hypnobirthing or know about it, you'll know that contractions should be called surges or waves. Next point here is the pain scale. I don't want to be asked about the pain scale. If I need pain medication, I'll request it. So for a natural unmedicated birth, I'll be working with a doula, and that's why I have her, and she'll help my husband and I on pain relief or positioning that will ease and make it more comfortable during labor. No vaginal or cervical examinations, and this is a personal choice for me. It's very common practice for an OB or a midwife to do them unless requested by the patient to refrain from it, but it isn't really necessary, or it's not a good indicator on how quickly or when labor is going to progress. Then lastly, I made a note about our daughter and for her to be able to move about freely and participate in the labor as well. The bulk of my birthing guide is broken up into 3 main sections. The first one is during active labor, and it's just wear your own clothing, having undisturbed environment, dim lights, and I want the hypnobirthing tracks that I used for my first labor to be used on this one. And then moving freely throughout the room. I am going to be having a saline lock to one of my forearms. No IV fluids are going to be running. I ask that I'm able to eat and drink at the same time with intermittent fetal monitoring, and this just means that they're going to use a Doppler and they'll just check on the baby once in a while. I'm not going to have that belt. And then I ask that the amniotic sac be broken on its own. Now onto the transition and birthing phase. So when it comes to hypnobirthing, there's this whole thing about breathing the baby down and not actually pushing the baby out. So that's a note that I made here. And then to also birth in any position, as opposed to that, laying flat back on the bed. I don't want an episiotomy, so that's where I noted just a warm compress or perineal massage. And then it'd be cool if I could catch the baby, that's all right. And then of course my husband to cut the cord. My last section is about the placental birth, and I really want delayed cord clamping, and all the staff know, my birthing team are aware of this, so that I would like the placenta to deliver on its own, and then to only cut the cord once the umbilical cord has stopped pulsating or has turned white, and then my husband will cut the cord for our baby. Now, for this to happen, it could take 10 minutes up to 15 minutes long. So this is something that's not regularly practiced. It's something definitely you have to request at the hospital if this is what you want. My last little bullet points aren't as important to me, but it would be cool if it got recorded. So I am gonna bring the tripod along, maybe, hopefully, and I do have one friend that's coming to help us, and she knows that I want it to be recorded or documented as much as she can do. So we'll see how that turns out. And then lastly, if there's any medical complications for the newborn, then my husband will accompany the baby. And that's my birthing plan. So I'm not trying to sway you into using this or doing anything that I have placed on my birthing plan. I'm sharing this for you just so that you get an idea of what it looks like and what could be on yours. Now onto my birthing team. I haven't actually seen an OB/GYN throughout the entire pregnancy. I'm only working with midwives. I have 2 midwives that I've been working closely at Eastside Birth Center in Bellevue, Washington. I am planning to give birth at one of their birthing suites, and if you want to take a closer look at that or how my appointments look like with a midwife, you can watch this video here. We're expecting, and that will give you a little short tour of the birthing center and how it looks different than a hospital labor room. During labor, I will have my midwife and also a birthing assistant to help with the midwife. And then I hired a doula, and I found her through Doula Match, and she'll be helping me labor at home and also go straight to the birthing center with us. Please comment below if you want me to do a video on why I'm having a doula, what they are exactly, what's their job, and the benefits to it. The last 2 people on my birthing team is my husband and then one of our friends. And her job is to manage our daughter. Our daughter is going to be 2 years old, and she is going to be present during labor. My expectation is that she'll just be reassuring my daughter about what's going on, giving her small tasks or jobs, allowing her to be a part of the labor team if she would like to. Don't have a designated videographer, so depending on how much footage we have, maybe we will do an episode and actually share the process and the whole story behind it with the Kachang family on YouTube. Please comment below your worst pregnancy symptoms and if you would love to see our birthing video. Well, that's all I have for today. Thank you so much for watching. I hope you found this video helpful. With love from the Kachang family to yours. I'll see you in the next video. Bye!